Welcome to the second module of our webinar series on creating gender-affirming healthcare environment for optimal HIV care. I am Dr. Andy McCrae, Scientific Director for the Annenberg Center for Health Sciences, and your host for this series. My pronouns are he, him, his, or anything respectful. In our first module, I introduced some key terms we used in the series that many people find confusing. If you haven't reviewed that module, I encourage you to start there. In this module, we review data on the health status of transgender nonconforming individuals and how that compares to our general patient populations. Unfortunately, we see some concerning and disturbing health disparities in the transgender and gender nonconforming population. Compared with the general population, lesbian, gay, bisexual, transgender, or LGBTQ+ populations have similar biology and basic health needs. However, the LGBTQ community encounters a range of barriers and experiences health disparities which are related to gender identity, expression, and sexual orientation. Homophobia is real. In 2017, there were 25 documented murders of trans women in the US. Another example of reported violence, 1 in 10 transgender nonconforming people who are out to their immediate family report being a victim of violence from a family member. Transgender people have mental health conditions related to both gender identity and general mental health issues such as mood disorders, anxiety, psychiatric conditions. Suicide and self-harm is a disturbing transgender disparity. In a 2011 Institute of Medicine study, 41% of trans individuals surveyed reported a suicide attempt at some point in their lifetime. This shocking statistic is at a rate 25 times higher than the general US adult population. As a result of social stresses, tobacco use and substance abuse are more prevalent in the trans community. In a 2011 California Department of Health Services survey, 30% of transgender individuals reported using tobacco and over a quarter reported drug and alcohol use. The chronic stress from homophobia creates not only mental health challenges, it also results in a higher prevalence of obesity, cardiovascular, and cerebrovascular disease. And relevant to this program, HIVs and STIs. Trans women who have sex with men have the highest HIV burden of any population group. In fact, a 2013 global meta-analysis study of lab-confirmed HIV infection documented a 19% prevalence among trans feminine individuals, nearly 1 in 5. This represents a 49-fold increased odds of HIV infection compared to cisgender or non-transgender adults of reproductive age. Unfortunately, there isn't much data on HIV infection among non-binary trans people and trans-masculine individuals. So what explains these disparities? And what can we, as healthcare providers, do for our trans patients to improve their health status? The principal driver behind the disparities we see can be attributed to the stigma and discrimination experienced by transgender nonconforming individuals in our culture and society. Through social and economic exclusion, this pervasive stigma leads to HIV-related vulnerabilities and marginalization, especially for trans feminine individuals. For example, in the trans feminine population, employment discrimination and social marginalization can lead to riskier sex work, with higher monies offered for condomless anal sex acts. In addition to societal stigma and discrimination, this population also experiences significantly greater barriers for accessing and receiving healthcare. Barriers include poverty, low rates of health insurance coverage, an insufficient number of providers trained to address specific transgender nonconforming healthcare needs, and the lack of access to prevention services and culturally appropriate health care. Finally, and unfortunately, when transgender nonconforming individuals receive care, it is frequently substandard with respect to being culturally responsive, patient-centered, and gender affirmative. Let's take a closer look at the drivers for disparities we see. Transgender people experience high rates of discrimination across multiple psychosocial domains, as documented by the report of the 2015 U.S. Transgender Survey. Stigma and discrimination frequently begin in school at a young age, ranging from verbal harassment to physical and sexual assault. In fact, many transgender youth fail to complete even their primary education due to mistreatment. In economic terms, transgender individuals experience much higher rates of poverty, unemployment, and homelessness. The physical and mental health consequences are significant, including much higher rates of severe psychological distress, suicide attempts, and a reluctance to seek health care for fear of mistreatment. Transgender people of color experience even deeper and broader patterns of discrimination. For example, transgender people of color are more than 3 times as likely as the US population to be living in poverty. The unemployment rate among transgender people of color is 4 times higher than the US unemployment rate. And people of color also experience greater health disparities. For example, 1.4% of trans individuals are living with HIV, which is nearly 5 times the rate in the US population. The rate among African American trans individuals is 6.7%. And if that is not shocking enough, the rate for Black transgender women living with HIV is a staggering 19%, nearly 1 in 5. It should be no surprise that any group that experienced this level of stigma and discrimination also faces significantly greater barriers to accessing care. There are clear and well understood connections between economic insecurity and barriers to care. A 2000 transgender needs survey and the 2011 National Center for Transgender Equality and National Gay and Lesbian Task Force report document how this impacts the trans community. With less than $10,000 per year income, trans people experience extreme poverty at 4 times the rate of the general population, and unemployment at twice the rate of the general population. This economic insecurity can force trans women into the underground economy, including sex work and illicit drug sales. That obviously increases legal jeopardy. But even in everyday life, trans individuals face unusual legal challenges. For example, many trans people have ID documents that do not match their gender identity and expression. People with mismatched documents are often harassed and/or denied services, including employment, use of a credit card, air travel, or even medical care. Another legal determinant for health disparity is a disproportionate rate of incarceration. Trans women who are walking in public, especially at night, are often assumed to be sex workers, even if this is not the case. As a result, they are much more likely to be harassed by police, arrested, and incarcerated. And multiple studies have demonstrated the widespread harassment and violence experienced by transgender people, especially those who can be easily identified as trans. Trauma itself can create barriers to care. Based on the discrimination they experience or anticipate, transgender individuals may postpone or avoid health care. And delayed healthcare decisions are always associated with poorer outcomes. For example, in a 2011 National Transgender Discrimination Survey, 28% of survey participants reported that when they were sick or injured, they postponed medical care, and 33% delayed or did not try to get preventive care. In a 2010 Lambda Legal report, even the anticipation of discrimination creates barriers to care. 52% fear they will be refused care because of trans status. 73% worry they will be treated differently. And 89% don't believe that healthcare professionals are adequately trained to provide appropriate care. This is the transgender life experience. All too often, when transgender individuals do seek care, they are denied the care they need. When they do seek care, it is frequently from uninformed providers. In a 2011 National Transgender Discrimination Survey, 50% of respondents reported having to teach their medical providers about transgender care. Even worse, when transgender individuals do seek care, 70% experience mistreatment directly from a provider, as documented in a 2010 Lambda Legal report. This constellation of barriers reflects the unique stigma, discrimination, and victimization experienced by transgender individuals, even when trying to access or receive medical care. We are better than this, we need to do better, and we can. In the next module, we will begin by becoming more familiar with how to have an open conversation with a patient about their sexual orientation, gender identity, and expression.